Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Dr. Luis Bossi with us today, and he is the main man at Greenspoint Dental here in North Houston, and you do all kinds of dentistry. He did Renee and I's teeth for us, and we refer a lot of our patients over to him. What's your website?
Website, greenspointdental.com.
There you go, greenspointdental.com, and this is Dr. Bossi. He's the main man there, and he'll fix you up with the dental, but we're going to fix his back now because he's doing this all day long, and we're going to get the kinks out of his neck and back. So let's have you face the mirror here for us then, doctor. All right, now let's relax there, and I'm going to check his posture just like we do everybody. Very good. I know the last few videos that we've had up have been not treatment videos, but videos of an interview we did with KRPC, because I had to have Renee video them so that we could get the real story out rather than what they made it into. And then we did another review one. So we're going to get back to our meat and potatoes of actual treatment on real patients with real conditions. And Dr. Bossi's also been having some problems with hiatal hernia for how many years now?
About 5 years.
5 years. All right, so let's go ahead and decompress you first.
Okay.
And he only comes in now, what, let's slide you in this way.
Every 5 weeks.
About every 5 weeks now, so he's kind of on a supportive care, maintenance care basis. And let's slide you down a little bit more, just this way. And I'll let him tell you afterwards what he thinks it's done for him. There you go. If you live in Houston, especially North Houston here, you should look him up. We send all of our patients who need dental work over to them. They're great, have great staff. Okay, there we go. Get in there. There we are. Now, nice deep breath in your nose. And just let it all go. There you go, good. You do all your own dental lab work too, don't you?
Yes, we have an on-site lab.
On-site lab where they do prosthetics and implants and all that stuff. So.
Full service facility.
Yep, in a full service facility. Drop it right in. There you go, boy, that was perfect. That's it. Been a while, huh? That felt pretty good.
5 weeks.
Yep. Did that feel good?
Well, feels excellent.
Yep.
Nice and smooth.
Yep. Well, when you relax like you do too, it helps. The people who relax always get the best adjustments. Okay, let's roll you over here on your tummy next. There we go. Right leg is short by about a ½ an inch in this position today, and it gets even. I bet you that tightens up in your lower back right there.
It does.
Yep, especially on this right side right there. So we're going to adjust his right SI joint first. There we go. And now to the left one, and I'm adjusting his hip joint simultaneous with his SI joint here. And then we're going to adjust his sacrum straight superior to inferior on the y-axis. There we go. Some in the z-axis. L5's right here. Pretty much straight down. You'll notice the angle of my arm changing as we move up. There's L3, L2. That one moved good. And there's L1. Then we'll put his head down a little bit here. Scoot up in there for me, please. There we go. And this is the lower thoracic area. It's really tough, so you wait on there. We go. Great movement. And that lower thoracic region is really very much connected to the hiatal hernia issues. Okay, that back's tight. So we're going to get in here and do some pretty deep elbow work. That's really pretty tender right there, huh?
Yes, it is.
And when you do this right in this area here, that's the thoracolumbar region, a lot of times the patients will feel that really deep in their gut. Did you feel that kind of deep in your gut?
Oh, yes.
Yeah. And I'm pushing down with my elbow and then increasing the amount of pressure as he continues to exhale. And you got to go along with the patient's breathing on this. And that's just to a feel thing that you get to know whenever you've done it for a while. And by the way, you should not be doing any of this unless you are a licensed chiropractor. Physical therapists aren't even supposed to adjust the spine or manipulate the spine. Yeah, boy, got a few little trigger points there. Now, he's bent forward all day long in his job, so we're doing things to counteract that. I'm not pulling the turbonator out on him today because I don't want him jerking my teeth out next time I go in. But we are still going to improve the circulation into his paraspinal soft tissues to help him flux oxygen and nutrition into the muscle cells, as well as expedite the dispersal of metabolic waste products of just normal everyday cellular metabolism of the muscles and ligaments and tissues surrounding the spine. So once you improve this circulation there, everything starts functioning better. Besides that, it feels good. Get out into his shoulders because he uses his shoulders and arms out front of him a lot. Especially over here in the teres major muscle right there is kind of sore. And right there too. We haven't done a video in a little while because I broke my toe on Thursday and I've been hobbling around for a few days, so I apologize about not getting our videos on there like we had been. But we're going to pick it back up again. Now we got some of our famous athletes coming back in to see us really soon. I think this week, actually. Very good. Even, I bet you that didn't tighten up as much either.
No.
Okay, so let's turn you on your back now. So now we've got his cervical, thoracic, lumbar spine, and sacroiliac joints. And now I'm going to check his knee stability and align his hip joint and his SI joint. From this end, that moved really well. Did you feel that all the way from your low back too?
Oh, yes.
There we go, good. Same here. Yes, sir. Good job. Okay, let's slide down just a little bit where your legs are hanging all the way over the edge. We're going to line his rib cage up too to straighten his shoulders out. Let's do this. This is my Jesus adjustment. Slide down a little bit more. There we go. And you mean that respectfully. There we go. There. Maybe just a little bit more. So there we go. Good. That's it. Right now I'm adjusting his costosternal joints, which are where the ribs attach to the sternum in the front. Costoclavicular first, which is his clavicle collarbone. And right there the lower ribs. Those are kind of painful, huh?
Yes.
Okay, let's slide you all the way back up that way and I'll pull your tummy down. Alright, take a nice deep breath in, let it all the way out. So I'm grabbing his stomach and I am pulling it back down through the hiatus into the lower cavity. Good. Another deep one, let it all out. There we go. And one more time, please. Perfect. Good job. Okay, let's have you sit up here. Miss Renee, there we go. Oh yeah, look at him sitting up straight now. And because he has his arms and hands out in front of him all the time in his job, just like I do, we make sure we get his shoulders lined up, his upper thoracics, and his elbows and wrists. Because our hands are important to us, aren't they, Doctor?
Yes, they are. That's the bread and butter.
We wouldn't even be in our business if we didn't have our hands.
It's the repetitive movement.
Yep. And that is what gets a lot of doctors, actually chiropractors too, is repetitive trauma disorder or cumulative stress disorder. Cumulative trauma disorder. Excellent. Good. So let's come over here in front of the mirror and shoot you. So now what we're going to do is we're going to send a message from his atlas through his brainstem, which is the medulla oblongata, into his cerebellum, which controls balance, posture, coordination, and all kinesthetic movement. We're going to send a barrage of neurological impulses into the cerebellum with him in a mirror image. Atlas right there on the right. And now on the left, I'm going to bounce the muscle spindles in his traps because he's had some real tight trapezius muscles here lately. Okay, now let's try that again, see how this feels. Range of motion's absolutely normal. It's back to neutral. Yep. Take a look at that. You're straight as an arrow.
Yes, I am.
Very good. Would you mind sharing with our YouTube subscribers and viewers how chiropractic has done for you?
Certainly. It in a couple of years back, I would come.
That's the mic.
I would come every week. Then I was able to go every 2 weeks. Now I come every 5 weeks. I've been on this regimen for 7-8 months. I hold up very well, and I know that if I don't come, I will slowly fall apart, and that's something that.
And how's your hiatal hernia been since you've been under care?
I don't want to do. The hernia has been much better. I've cut back significantly on taking Pepsid. I take it maybe once, twice a quarter, 2 doses per quarter. When it gets really bad, it's been extraordinary just to have this and not have to take medication and be relieved of the hernia
and the acid
and the reflux and all that without medication. And of course, you know, I always eat the wrong thing at times, and that's when it reoccurs. But it's been excellent.
But you know where to come when that happens.
I sure do.
Yeah, thank you very much for sharing your story. Would you advise other professionals to get chiropractic care that are in a bent forward position?
Oh, I think not just professional, everybody,
yeah.
Whatever your line of work is, you're into repetitive movement. You do the same thing day in and day out, and this will get you in the end. So to keep feeling good, working hard, and living life to the fullest, go see Dr. Johnson so he can take good care of you.
There you go. Well, thank you very much for the plug.
You're welcome, sir.
All right. This is your Houston chiropractor. We'll see you next time.